Welcome to the Smash Podcast with Adam Smash Smith. I'm your host, Shaheen Azizi. Training with injuries. What are your thoughts on this, Adam Smith?
You know, this is a good opportunity for me to kind of play both hats. You know, I've had this a lot of experience in this on both aspects. As one, I'm a teacher that wants the best for my athletes, so I always want them to be healthy and recover so they can get back on the mats because I know how important it is. I've also been an EMT for 12 years, so I kind of have a little bit of an idea behind injuries and the body and stuff like that, so I don't just say things from like a completely, idiotic space. But then I also am an athlete that's been a professional that's been injured, myself having to go through hip surgeries. I've had 3 hip surgeries. I'm going for my 4th hip surgery tomorrow, my 2nd total hip replacement. And all the while, I still trained, competed as much as I could in Brazilian Jiu-Jitsu, which is a sport where people know that you need to use your hips quite a bit. So there is also that realistic aspect that I know firsthand how to train as an injured athlete. So I want to be able to give kind of both sides when we go through here is one, what a teacher would look for and what I hope for an athlete, and what to watch out for, but also as an athlete that's like, now I still want to achieve my world championship goals.
So from the perspective of the student who is maybe not a professional athlete but still really wants to dedicate themselves, what kind of suggestion would you give to them if they're just starting?
That's great because that's it, exactly it. Not everybody's out there to be a killer, be a world champion and stuff like that. So that's kind of where my instructor hat comes into play, where it's like, okay, I want everybody to be able to do this sport, and I want them to be able to go to work the next day, work a job, make sure that they're there for their family and stuff like that too. So with that being my background in like what my attitude is into people, I still encourage people to make sure that they're on the mat as much as they can when they're working through the injuries. The reason is because there is so much more of a psychological benefit than people even give credit to behind not stopping like your training, that continued progress that maybe you've been on for a while, because by the time you take a break for an injury and you come back, people build up all sorts of anxiety from the what ifs. What if people don't like me anymore? What if I am not as good as I used to be? What if this? What if that? There's that'll stop you from getting back into training even at the right time. So I encourage people as a teacher to stay on the mat. Really, it's like, what can you do that's going to help you to stay on the mat possibly? So like, can you still watch class from the side? Can you still do some drills, the extent of your injury? Obviously, anybody's going to know that, some of the most important thing is to understand your injury before you do anything. So if you have a doctor, if you are a doctor yourself, there's a lot of medical professionals that do this kind of stuff. And, myself, like I said, was an EMT and stuff. So I kind of been a martial artist my whole life. I know my body a little bit. And so I can kind of address my own injuries. Like I kind of know, okay, cool. I know what this is. I know it's a soft tissue. I know if it's a musculoskeletal thing and stuff like that. And I can kind of address some stuff to myself. And then I know when it's out of my hands and I need to get help, right? So if you can't understand your injury, or if you don't know where you are in that process, then get professional help. That's the most important thing, and it's important because that's what's going to help you stay on the mat, and work around the injuries, and also make sure that you're not making it worse so that you can get back quicker.
So it's essential that you're at least paying attention, even if you can't participate. I still come to class. I'm being part of the team. I'm maintaining my schedule, and I'm still trying to listen to what you're going to teach, even if I can't participate.
Yeah, this is exactly what we talked about kind of in the last episode, is you can go to the academy and work on being a good partner. And there's so many aspects of like being a good partner, and a good teammate, and a good person of your academy. So being there to encourage people, to watch people on their progress, just even the high fives and people seeing you there on the side of the floor or wherever you may be with an injury. is encouraging to anybody else that comes down with an injury. You're bringing up the attitude, kind of what we had talked about in the last episode was, you can help improve the attitude of the academy just by being there, even though you're injured. And so sometimes people get a little selfish and they don't realize that they still actually bring value to their program, to where they're at, just by even showing up. So yeah, get on the mat if you can. If your instructor lets you, put your uniform on. I know that for me, whenever I put my uniform on, it's like I turn into a superhuman, So I put my uniform on and all of a sudden I might be able to do a couple more drills than I didn't think I was able to do. Or, maybe I'm just, now more receptive to being able to learn just because my gi's on, my belt's on. All of a sudden it puts me into this attitude of like receptive learning and being a student. So, if you, as far as you can get into training, do it. If you can go all the way with just being able to do drills and not being able to roll, then that's it. And if you can't, if you can roll at the time you're able to roll, then that's great. It's something I had to use a little bit for myself, but I'm a little bit too much gung ho, so I just always push through it.
Would you say there's a point where a student might take this a little too far or be a little too tough for their own good? And what are some things to notice that you might be missing that you could possibly hurt yourself further?
Ooh, that's a good one, because this is where I ended up in a problem. This is why, kind of why I need double hip replacements. I probably could have solved this issue years ago. Mm-hmm. I have an impingement problem that happened from training martial arts my whole life, every day, thousands and thousands of reps every day, kicking and stuff. I have like a soccer player's impingement where my cartilage has just been pounded away on. Mm-hmm. And there was a time that if it would have been, 10 years ago, before the cartilage had, kind of destroyed so much, and then it grew these bone spurs, and the bone spurs ended up delaminating my cartilage within my hip. There's a time before that I could have gotten the bone spurs shaved down, and I could have saved, myself from needing a total hip replacements maybe at 33, which is optimum, because I don't really like to do this invasive of a surgery for somebody as young as me. So there is that part of me that when I realized that I was in pain back when I was like 18, I remember when I was 18 and I realized I was like, I can't do the splits very well anymore. And it hurts a lot. And I used to tell my karate instructor, like, yeah, I can't, things aren't going as well. And I would still just kind of push it. I think at that time, if I would have had the insurance and like the support system behind me to like push me, encourage me to go to, the doctors, like that would have been the best choice. And like I said, when I was leading off in this kind of introduction, was knowing your injury is going to be your most valuable tool. So if you don't know your injury, if you're not a medical professional, if you're not somebody that's maybe like hyper, aware of your body and stuff like that, get that professional help sooner rather than later. So then you can train with that injury better. Maybe you're not able to go get the surgery right away, but you know exactly what to stay away from. If I would have known that I was having these bad hip problems, then I probably wouldn't have been doing so much whipping kicks and stuff like that, like Thai kicks and things that just totally was like really bad for me. I mean, that's what caused a lot of the delamination from my cartilage. And the doctor, people were just surprised, like, how do you even do this to your body at your young age and stuff? And so I think, yeah, knowing your injury is probably the best piece of advice I could, pass down to anybody.
So really, it's like having a consistent mindset, choosing the right environment, having the right attitude, showing up, but also knowing when to make an intelligent decision, asking for help, and making sure that you are taking the right steps so that you can continue doing this without furthering to hurt yourself.
You hit the nail on the head. Let me just tell you, I personally, I guess I can't speak for everybody out there because it's definitely not true. Some people are really out there just to make money and stuff. But I love to teach jiu-jitsu because I want to help my students, get better and be better people. So if somebody's injured and they are asking for help, usually I would say most of the time the instructor is going to be pretty receptive to wanting to help you. You know,
Yeah.
if your instructor is not receptive to wanting to help you during an injury time, maybe you should look at finding another place to go, because that, that to me would be like a red flag and somebody that's not going to help you get a little bit better at what you're trying to do here. So I think that one of the most important things you can do is work with your your teachers, your instructors and stuff like that. Make sure that as you know your injury, that they also know your injury as well. Because, even you don't have to sit down and have a science conversation with them and let them know like every bit of what you've been doing, but just clue them in. I mean, most of these guys also, if they're higher level, athletes, they understand body parts and stuff like that. So they're going to also understand how to stay away from that, give you ideas on how to mitigate your body movements to save yourself. And so those are the things that you can work right there. And just like that, ask for help. If you're not one that wants to ask for help, especially like in jiu-jitsu, but in martial arts period, you're probably not going to move very far, because this is one of those things that, your ego is not something that's very good for this martial art, So anyways, the better you can start to ask for help in a lot of aspects, the better.
And in situations where you feel like you've gotten as much information as possible and you're not repairing as quickly as you would like, what suggestions would you say? I mean, obviously go back to your doctor, but if someone starts to get discouraged, what's a good idea? What's a suggestion there where, they've tried to keep coming back to class, but maybe their ankle's still bothering them and they're starting to feel like they're not going to be able to participate and keep up because they actually haven't been practicing some of the moves, even though they've been watching them?
It's like, that's great, because really, I think, most of the time you're going to solve a lot of that by being on the mat. Mm-hmm. And so, your attitude shift will happen if you're there, a part of that good environment and stuff, where you kind of understand that you can still grow in a lot of other places. But I tell you what, when you're sitting at home on the couch, that feeling of not wanting to come back is going to be 100 times worse. Mm-hmm. And so, I mean, that's great that you actually said that, because I'm not going to tell you that feeling's not there, because I tell you, for myself, through my injuries and stuff like that, I have just so many days just sat there and been like, this is really discouraging. Mm-hmm. I don't want to do this. I just want to kind of go home and lay on my bed and sleep, and because I can't do it like I want to. Like, I tell you what, for the last 4.5 years, I've been dealing with severe hip problems, and I'm a professional athlete. I have 20 professional MMA fights. I had a lot of jiu-jitsu tournaments and matches and stuff, and high-level grappling and stuff. Like, I've been doing karate since I was 5 years old. You can go to my office, and I got tons of trophies. Anyways, I've been doing this and competing since I was 5 years old, and then all of a sudden that stopped when, like at 4.5 years ago. So I tell you what, if I would have listened to people that told me I would never be doing jiu-jitsu and martial arts again, and I would have stopped, I would be in a hard place right now. Even after getting both hips done and maybe being able to get back on the mat, I probably wouldn't get back on the mat after 4 years off. So just, keeping, obviously I teach, so that helps me a lot too, but just staying into it a little bit, making sure that I'm still practicing some stuff for myself and progressing myself forward. I've done some competitions, even though I knew that I was handicapped. like I know I'm going out there competing. At one point I competed against the number 4 heavyweight in the world in the submission underground, and I could barely open my legs. I need double hip replacements. I have terrible inflammation. I couldn't train at all for weeks, and it'd been even a couple years, but I still wanted to go out there and compete, because the opportunity for me to get out there and feel like I'm moving forward still with my career and my life and what I want to do and what I've looked forward to as a kid was far greater than me laying in bed for a few days because I was in like really bad pain. I did get new hips anyways, so it didn't matter. But
so it seems to be that being cerebral is very important in a large portion of jiu-jitsu, not just the physical aspect. And this kind of leads into the whole optimism thing, right? So What is your thoughts on that factor?
Listen, I do this not as a jujitsu, practitioner, because I had read some stuff, a while ago about like even some of the origins behind of like what the guys that were doing jujitsu were doing, opposed to like some different martial arts styles we're doing. So I have more of an expertise on like a martial artist and like the Kempo practitioner that I am than I do actually with the jujitsu side of things. And I say it like this: the cerebral part is everything. Attitude is the first 50% of how you're going to accomplish anything. If you don't have the right attitude, you really are going to have a hard time accomplishing. That's why we talked about that the last time, And so just, keeping that kind of stuff to the forefront of, am I being smart when I'm making any of these decisions?
Yeah.
Training, not training, when I should train, when I shouldn't train. That's going to benefit you in any part of your life, like just making, educated decisions. That's part of being a martial artist. And that's really where, I hope to make these kind of mesh, like the jiu-jitsu and martial arts, a little bit more of that, like, oh yeah, we'll be smart, aware people that are able to defend myself on the street, not jump into my back and let my head hit the concrete, all that kind of stuff, a little bit more than like I need to win a tournament.
So maybe even the first decision before you start thinking about not hitting your head is, should I even engage in this altercation before I even start thinking about whether or not I'm about to slap the back of my head on the concrete, right?
Yeah, because I'll tell you what, the last tournament I thought it would be so cool for me to come back and win with a flying triangle. Like, first tournament back after a hip replacement, and I thought I would come back and win with a flying triangle and stuff. And I jumped and I got my legs wrapped around and I wrapped that triangle up and I finished and I won with the flying triangle. But in the process, I fell on my back, right on my shoulder, like my neck, and it's like 3 weeks later, and it still hurts terribly bad. So, anyways, that's kind of the stuff that I don't really recommend for like the street and stuff like that. But you can go out there and mess yourself up.
So actually, that just sparked a great idea. With obviously, you want people to listen to their doctor, but what does this have to do with people needing to take anti-inflammatory drugs or painkillers, and how that might get into a vicious cycle, and why that really plays into making intelligent decisions so you don't end up in a situation where you're in that vicious cycle?
That's great. Honestly, let me just break it down in not necessarily a jiu-jitsu, but like a martial art or like a sports or an athlete aspect, period. If you ever did an athletics, you might be able to relate to this, or you might know of somebody that you can relate to when it comes to this. If you were a football player or a wrestler or a track athlete or a volleyball player or something like that, and you something that you've done your whole life and you're dedicated to it and you put your passion into it and you spend all that time that somebody that wants to get to the higher levels needs to do to get there, and then you at some point in your career you get injured, okay, you're gonna have a problem. People, the more that you can prepare yourself for what is gonna happen during that time is gonna be the better, on any athlete aspect for you. So I think when it comes to making sure that you have the support system in place and the understanding of what you need to do when you get injured is first and foremost the most important thing that I could pass on to anybody. Because here's what happens. If you get injured and you do sports your whole life and all of a sudden you have an injury and now you hit this real life sports depression and you don't have a support system, people start to look for something to fill the place of their athletics because they're not at the the football field or the soccer field or whatever, and they're sitting home and they're depressed and they're probably by themselves because most of their friends are probably on the team and they're probably playing in where they want to be right then. So not only do you not have somebody that you can call your friends because all your friends are playing the thing that you want to really do, but you're depressed because you can't do it. So that's what leads people to find substances, things that can help them get away from that pain. Like, I have seen it a ton, like I know from my own experiences in the past how it can ruin your life when you just don't have that set up ahead of time. I think if there's people out there that are coaches, stuff like that, people talk about it now, mental health and stuff like that. It's going to be this preemptive mental health that we can start to provide to like younger people, like in the elementary, like middle school. Like, this is what happens if you're an athlete and you get injured, you need to do this, almost like pictographs, things like that. You do injury, you sit on the side and support the team, you get back to playing. Like those same tactics that they use to teach you how to wash your hands for the right amount of time and sing the songs and stuff like that. Like, those little things are going to help some of these athletes a lot more. Now, the problem is if you have these people and they're getting into substance abuse leads down the line, we already know, to a lot more problems within the families, within homelessness and stuff. You might be able to go on the street and start to talk to some homeless people and say, hey, what'd you used to do? And some of them might say, hey, I was an athlete, I got injured, stuff like that. Obviously people have a lot of other excuses too, but
So it really seems like there's a theme here, and the success really starts in the mind. And so, just to cycle back to episode 1, it's really about finding the right environment, having the right attitude, and then we also cumulatively, you bring all of that together, and that's how you make the better decisions so that you don't hurt yourself, so you can keep coming back and doing that and growing as an athlete.
Yeah, I think you just exactly that. It's what you want to get out of where you're at. It's what are you signing yourself up for? Like, if you're doing jiu-jitsu, did you just sign yourself up to do jiu-jitsu because you want to be an MMA fighter? Or are you signing yourself up to do jiu-jitsu at a facility because you want to improve yourself as a person and get better and things like that? I mean, those are going to give you kind of different ways on how you go about things. But for me, I want my students to come to my facility because they want to be better people, inside, outside. We all learn and work from each other. Like, I have this pastor Jamie, and it's like, after I get done teaching or Ryan gets done teaching, like, he'll sit down and he starts to be able to teach with people that are there and stuff. And it's like, because everybody gives each other that respect, and especially like in their professions and stuff like that, and we're all there to improve ourselves. And it's also something that's good leadership when people watch the leaders of the school still trying to learn, humble themselves, and be better and stuff. So that's what we're in it for at my academy. Some people are in it because they just want to be the UFC champion and they want all the money and all the babes and stuff like that. But if that's you, just find another place for mine. That's why we're not an MMA school. That's why we're a jiu-jitsu and a martial arts academy.
Well, and that leads me to this other point for, let's say, the teachers that are listening to this. It seems as though empathy plays a large role in being able to communicate with your student and see what they're going through, but also making an informed decision to make suggestions without maybe pushing them to feel like if they don't come back to class that they're making bad decisions, but also still supporting them to regain their health, right?
Yeah, exactly that. This goes back to what we talked about before, was, if you want to be a good teacher, if you're looking for somebody that's a good teacher, it's somebody that's going to treat people as they are, kind of their individual and stuff. And I'm going to react to you based on who you are as a person. So, some people need that real empathetic, like, oh, I'm sorry, like, I'm here for you and stuff like that. And some people need the
The
Well, that
push.
sucks. But I hope to see you back on, still on the mats,
Yeah.
kind of that different of an attitude and stuff like that because, the one style doesn't fit all. And like I was talking about the turnover rate in jiu-jitsu and stuff, like this can be a time where people get injured. They go for support from their teacher. The teacher doesn't give them the support that they feel like they need as their person, and they give them a different response, even though, that might not be a wrong response. Like, probably a good response for a different person.
Yeah.
But this person felt like they wanted a different response. So, as a teacher, the more that you understand, who your athlete is, right? This is why it's hard to have a school that has like 5 million people, because how are you supposed to know that
That's
person,
a broad,
And so,
yeah.
for me, like I'll have caps at my school and say 200 members each, and it's like people, I can't keep track of that many people in my head, so I can't encourage and be the teacher that I want, and that's enough. That's more important than me than being a rich guy.
And as this would also combine with the factor of being able to be the kind of supportive teacher that can help hold you up or help force you forward. Maybe not force, but the bird that needs to fly, and also reassure you that you're good enough to keep going now. You're not still hurt. Take that step.
Yeah, as adults, we have gotten away from people pushing us. It's something that, and not only it's not 18 that you lose that, where your drive to get pushed from adults. It's back when you're like in the 15, 16-year-olds, and you're trying to like drive your own car and stuff like that. And you don't want listen to your parents and don't want to like do what they say. And when your coach says something that you still just in your head think that you got a better play when you're out there running the field and stuff like that. Or, these little talks that you have with your buddy about, when you're 16, 17, about the coach doesn't know nothing, all this kind of, it's like that stuff, that's when we start to not want to get pushed by outside influences and stuff. So to get away from that push and then put yourself back into that, part of life where you're trying to get pushed again at the right times, it's uncomfortable for people, and that's a lot of times when people quit too, and the turnover rate happens there. But if I get that, people come and go, and no matter what, I've had tons of students come and go. That's just how it goes, period, But what I don't get is I don't get a lot of people that are talking bad about me, about like the way that I like talk to them, or any of that. Like, even on our Google has like 42 5-star ratings, and the stuff that people say on there is like the most heartwarming stuff that I, can imagine. Just people are so thankful for the opportunity, the way that we are, our family dynamic at the school, the way that everybody kind of treats each other. So it's something that I know that I do, a good job at also. But
So all in all, really, you need to be concerned. You need to show care. You also need to be sturdy so that other people can see that you are showing them what it means to be tough without also pushing that egotistical narrative where you might hurt yourself.